Hello, everyone. Welcome. Today we will be reviewing tips as well as CPT coding. My name is Instructor Bennett, and I will be your facilitator for this session. So here are a few tips that you might want to consider while you're taking the course. You want to make sure that you're managing your time, and you can do this by scheduling a few times throughout the week to complete assignments, to practice, to study, things like that. And you want to schedule it because this way you make sure that you have enough time to complete everything that needs to be completed. You want to make sure that you're reading your weekly announcements as well as reading your emails. Again, a lot of times we have additional information that we're emailing you or that we're putting in an announcement. So it's important that you review your emails and your announcements. So some of the resources that you're going to be using is you're going to, of course, use the announcements, the platform in the classroom, an online dictionary, your coding manuals. Also, you'll be using your textbooks as well. So one of the key things that I can give you as far as with coding, the only way that you are going to get good, get proficient at it is to practice. There is no magic bullet to coding. It's a lot of information. You don't have to necessarily remember everything, but you need to know how to use your coding manuals. You need to know how to use the tools that are given to you. You don't necessarily have to remember codes. So keep that in mind as you're going through your courses and you're looking at the amount of information. Just keep that in mind that you are learning how to use the actual codes, how to apply concepts, and things like that. So practicing is what is going to help you to become more proficient. So you should have a CPT HCPCS and also an ICD-10 coding manual. Those are the three manuals that you will need. So make sure that you have all three coding manuals. So the first thing that I like to tell students whenever you're going to learn a new section of the CPT book is first review your coding guidelines. One, they are in your weekly chapters, but also the coding guidelines are at the beginning of each chapter inside of your CPT book. Now, one of the things that I recommend is that you have your CPT book open along with your textbook, because this way, when you're reading information from your ebook, you can now cross-reference that to what's in your actual CPT manual. So I'll give you an example. So this week, we're going to be reviewing gastroenterology. So what I would do is go to my chapter that's on gastroenterology, and then also have my CPT manual open out to that same section. So what I'm going to do now is I'm going to continue to share my screen. That's why I have it set up this way, so I can actually show you some things. Now, my CPT book may look a little bit different than yours, but everything is still the same, what is inside of it. So if you haven't done so already, you might want to read the beginning of the CPT book, and it'll kind of give you some background information on it. So you might want to read that first part there, the fundamentals of CPT coding. If your book says something else, that's fine, but you might want to read that first area of the CPT coding manual. So each section of your CPT manual has what we call coding guidelines. So for gastroenterology, which that is one of our chapters for this week, it's going to fall underneath the surgery section. So I'm going to go here to the surgery section and see how they have guidelines here. This is what I'm talking about, that you need to come to the surgery section, review those guidelines, because those are going to apply to the guidelines in gastroenterology. Because those actually, gastroenterology is actually a subsection in the surgery area. So you want to make sure that you review that information first, and then you're going to go to the section of the book that you're going to be doing. Now, of course, once you read the CPT coding guidelines for surgery, and let's say you go on to respiratory system or cardiovascular system, those same basic guidelines will still apply. So you don't have to come back and read it again then. You just want to then just go to the section that you're going to be reviewing for that week. So I'm just going to point out some key highlights that is specific to surgery. And that is, in the surgery section, you'll have what's called a global package. This is normally going to be what we call where you get everything all in one. So they call it a global package. So what's included in that global package is normally going to be the surgery. It's going to be the initial evaluation for that surgery, any preoperative things that need to be done related to that surgery during that global period, the surgery itself, and then anything that's in the post-op period. So read further about what the global package is here. If you need more information, I can send you some additional resources. But basically, the global package is everything is going to be covered underneath that one payment. So this is going to be the surgeon's initial evaluation. There's 1 day pre-op that's covered under the global package. And then anything that's related, like I said, during the actual surgery, you want to make sure that you don't bill separately for those for any of those services, because that's what's going to be called unbundling. And what's going to happen is the surgeon is going to get paid for things that were already included in that surgery package. Depends on what type of surgery it is. That's what's going to determine how many days after the surgery is covered. So if it's a major surgery, it could be as many as 90 days. If it's a minor surgery, it could be like 10 days. So it just depends on the surgery, how much time will be included in the post-op. So then you're going to go to your section after you read all the guidelines underneath your section of surgery. You're then going to go to the section in which you're going to start coding, and you want to review those guidelines. So I'm just going to go to one randomly. So let's see, we can go to, let's see, urinary system. So when you go to urinary system, there's going to be some information that's specific to the urinary system. So that's what this information is going to be under that particular section. So these will be things that only apply to urinary. So that's why you want to read those guidelines before you actually start coding. If this is your first coding course, what you want to do is go to the announcement section, and I'll show you that right now. Go to the announcement sections. You'll find resources on CPT coding, ICD-10, and I have to add some others, but you will find lots of information and resources in the announcement section. And I actually have to add a few more. But if this is your first course, come here, click on CPT coding resources. This is a great video to review. This is an overview on CPT basics, and also tab in your coding manual. You want to make sure that you read this section, because if you haven't done CPT coding or you need a refresher, this is a great opportunity to go back and review. You're going to find that when you're learning things, you'll learn them more than once. That's called the layer approach because it's a lot of information that you have to do. I know that the video says 2020. It's okay. The basic fundamentals of coding still apply. There has been no significant changing in CPT coding under the surgery section. So those videos will be fine just to give you an idea, to show you how to use your book, to point out different things, to give you examples of how to code. These are great resources. So first start off with this, and then I've put one in here for each of the sections, integumentary. The evaluation and management, I might need to update that one, but you still can go in and take a look at it. Cardiovascular, radiology, digestive, pathology, all of these are pretty much the same. So we have a lot of the different sections here with videos. And the reason why I like these videos is because they're actually using the book, showing you in the book where they're looking at so that you can be looking in your book. So use the resources that are out here. There's some for ICD-10. If you're not doing ICD-10 right now, don't worry about it as much, but I would take a look at the overview, because then that way, if you come across any cases that need ICD-10, you have an idea of how it actually works. So here is a video for that as well. And then these are more detailed sections of ICD-10, but nonetheless, they're here, so you can take a look at it. Other thing that you want to start doing is start building resources. So adding videos, web links to your favorites so that when you go out into your new career in healthcare, that you have access to the resources that you need. So be sure to start building up those resources. So what I like to do is I use Google Chrome a lot. So I'll just hit the star and it'll bookmark it and add it to my favorites. You can make a folder and put all your coding stuff in one folder if you like. But start building those resources so that you'll have access to these resources once you're out of this class or out of the program and you're already starting. So start to build those resources, because you're going to find out that everything is not going to be in one place. Things are maybe in multiple places. So that's why you want to start building resources so that when you have questions, you'll have somewhere to go. One last thing I'm going to point out before I go any further is I know you guys are busy, but coding is not something that you're just going to get just without doing a lot of studying. So each week, and it's actually going to be in your applications course, you will find the weekly PowerPoints. If nothing else, make sure that you at least review those PowerPoints. So for example, here's the one for the coding one on the digestive system. You just click on it. You don't even need PowerPoint if you're using a mobile device. This comes with that time management. Maybe you don't have, 2 hours to study or 4 hours to study. You got 30 minutes. Come here and look at your PowerPoints. Review these. This is a great introduction to what you're actually going to be reading once you actually go and start reading for the week. So at least it gives you an outline. So take advantage of, the PowerPoints as well. This is another thing. If you want, you can download it and save it for later. Maybe you got a question later. You don't have a question right now. So these are your resources. More than happy, to download them and keep them. And then that way you'll have another point of reference. So just wanted to point that out. So now I'm going to jump back over to the PowerPoint because I kind of talked a little bit about the guidelines. So always get this question. I don't even know where to start, once I'm starting the code. So these are just some general guidelines. You don't have to follow these, but these are just some general guidelines that you can actually use. If you want, you can take a screenshot of it and maybe use it as, a tool that you want to make sure you got everything, you coded all the services. These are some of the things you want to think about. So what service was provided? Was it a procedure or was it some type of visit? So that's the first thing you want to look at. You want to know whether it was a physician, or when they say qualified healthcare professional, that could be a nurse practitioner or a physician assistant, but most of the visits will be with the physician. So what was the main service? Was it a procedure or a visit? Was there any additional services performed? What's the age of the patient? So you have some services that are age specific. So you have to choose the code according to that patient's age. You, when you go into the surgery section, here are some things that you want to think about. What method was used? What was the instrument? And then what was the approach? Because you could have one procedure, but if there is a different method, that could be a code, a different instrument, that could be a code, a different approach, that could be a different code. So you want to make sure that this is where coming into looking at those details. So these are more so for surgical procedures. So that's why they were saying what method was used, what instrument, and what approach was used. You want to think about what was the anatomic site that was treated. So what area of the body, what quantity was provided or time spent. So some services are coded based off of time. Were there any complications or anything that was unusual? Sometimes a procedure is started and the doctor has to stop for some reason. They can't go further because it won't be beneficial to the patient. So that's just an example. Was there more than one provider involved? So some surgeries, you may have two surgeons. You also want to know what is the final diagnosis. So these are just some general guidelines of things that you can think about. So you'll have your case study. So that's the patient record. So the first thing that you want to do is you want to research the procedure in the index of your CPT manual. So you'll go to the index and you'll look up if the patient got a colonoscopy, for example, you'll go to your index and you look up colonoscopy. So one area that students have an issue with is identifying the main term. The main term is normally going to be either the procedure or service that was provided. You can look it up by the organ, the condition, an abbreviation. So this is how you're going to identify the main term. So first thing you're going to do, you have your colonoscopy, report there. So now we're going to go to our index and look up colonoscopy. You want to review modifying terms and any instructional notes. So when you go to the index, it may say see next, the also see. So it may be some other instructions that it's giving you. So make sure that you follow those instructions. Then now that we've found our main term, we're going to research, so now that we have the main term, so it's going to give us a code right there. So once you go to the index, you look up colonoscopy, it's going to give you a code right then and there before you go any further. But make sure that you do not just use that code. And the reason why is because when you code from the index, you're going to miss any additional information that is available about that procedure. So make sure that you never code from the index. Always have the code. Now let's verify it in the tabular list. So we're going to actually go into the CPT manual and look at that code and see, is there any additional information there, any other guidelines? Is it telling us to do anything else? You will code things incorrect if you code from the index. Now, sometimes you might have it right. You might have a 50-50 chance of being right. Well, here's the problem. When you start to teach yourself to code that way, and because you're getting it right, you're getting it right, you're getting it right, when you go out into the workforce, you will have to code and have things coded correctly. And there is a percentage that many organizations use to say, okay, we're going to audit your charts, and there's a 95% rate. So that means that 95% of your charts have to be coded correctly. So let's say if you got 90% coded correctly, that's not good enough. So that's why make sure you don't take anything else from what I'm saying. Make sure you never code from the index. And you will hear it being said many times because many people get things wrong and start to learn how to code incorrectly because they're coding from the index. So make sure that you don't code in the index and that you take the time to verify that code in the tabular list. Make sure you do that. So I like to always spend a few minutes just to say, don't do it. It's very tempting. Take the extra 10 seconds to go in the actual chapter and make sure that what you saw in the index is there's no additional information around that code that you need to do anything else. So verify the code in the tabular list. So once you get to the tabular list, if there are any additional information there, so if there's any additional guidelines, any special instructions, another thing that you'll miss is if there are any symbols next to that particular code, you're going to miss it because you won't see it in the index. The index is just what it is. It's an index. So you're going to miss any symbols. So the symbols are at the bottom of the page. These are some of the symbols. So if it's an unlisted procedure, if it's a separate procedure. So there's different things that are at the bottom of the page. Is it a new code? Is it a revised code? Is it an add-on code? So these are things that you want to know that you're not going to find in the index. So make sure that you're not coding from the index. So for example, this code here, 50080, see this little triangle? You have to go down and it's letting you know that this code has been revised. So if you use this code in a prior year edition, make sure that you read it thoroughly because they've changed some things on there. So that's why they have that there. Remember, and I can show you the index really quickly, that you're not going to there are no symbols in the index. So I'm just going to click on index. I'm not going to anywhere specific, but I'm just going to show you like what the index looks like. And so this is what the index tells you. So let's say if you were going to code, let's say incision and drainage of the abdomen. See, it's just telling you incision and drainage of the abdomen. Uh-oh. But it didn't give me any other information. It's just telling you where to go. Now, some codes, so it's telling you can use 49020 or 49040. But you want to go to that actual code to see what else is there. It may be some additional instructions. It may be a new code. It may be some differences in those two codes. So I'm going to just go to that one really quick, 49020, so you can see what I'm talking about while you want to go and see that extra information. Now, this is an ebook. I wanted to pull it up so that you guys can see what it is and how it looks, but you want to make sure it's very similar. So I want to be able to show you. So once I put in that 49020, it's telling me that it is for abscess for incision and drainage. And then there was another code that was there as well. And you can actually look up that code as well to get the information. So this is still bypass the index. Oh. Okay, here we go. Here's the actual. So when you go to that section, which, and this is why I recommend students don't use an online, because see how it's jumping me around. If you have the actual book, it'll take you right there. So what it's actually doing is stopping everywhere where it sees that information. But the moral of the story is just make sure that you don't code from the index, because you want to be able to look and see if there's any additional information. Now, you guys probably have the CPT Professional Edition. This book is actually slightly different, but the information is still the same. Okay, so we kind of reviewed already why we want to make sure we don't code from the index, because we want to get that additional information. So always before you actually assign the code, refer back real quick to the actual documentation to make sure that you're choosing the correct code. Because sometimes, and when you're doing a lot of coding, you may miss a small detail. So just go back and just check it. You don't have to read the whole, report again, but just go back and at least look at, at least go back and look at the top part of the report. So you have the op report, and at least make sure that you know what procedure was actually done. So just go back really quick and make sure that you have the correct procedure. Now, most places that you work, even in real life, the notes will look similar to what I have up on the screen. So it will always tell you what was actually done. So in this case, this patient got an EGD and an attempted colonoscopy. So that is no, that's going to be it. That does not change. But what could change on there is the diagnosis for the patient. So your pre-diagnosis may be different when you get to the post-op. So just make sure you use post-op diagnoses. So this is just a sample report that I just pulled up really quickly. This is an op report for our patient, Wanda Jefferson. The pre-op diagnosis was weight loss, abdominal pain, occult positive stool, nausea, and the post-op is the same thing. So we already know what the procedure is, but you want to make sure that you review the procedure and see what was actually done. Because sometimes this operation, what was actually done, is very generic. And if there was anything additional, or remember how I had, you want to look at how was the procedure done, what instrument was used, what approach was done, that information is going to be all right in here. So that's why you want to make sure you review it. So I'm not going to actually read this, but I'm just letting you know, make sure you read the documentation. But at the end, you notice here that they're saying, however, the scope could not be advanced, so the procedure was terminated. So this patient came in for a colonoscopy, but it was not completed. So that's a key thing that we need to keep in mind. Remember, on some of those guidelines that I had gave, I mentioned some of the things you want to think about when you're going to actually assign a code. So here we go. So what was the method, the instrument, the approach, the location? Was there any time spent? And then what complications or unusual circumstances were encountered? See, when they had to stop, that was something that was unusual. So just keep that in mind. I just want to show you that. Okay, so now we got all of our diagnosis and we know our procedure that was actually done. So in this case, we'll assign a diagnosis for the abdominal pain. We'll assign one for the weight loss. We'll also assign one for the positive stool, and we'll assign one for the nausea. So that's what these are here. When you get into ICD-10, and if this is a review, you'll know that in the Z codes, this is where you're going to find certain information. And I had a video out there on Z code, so you can take a look at that as well. So for this one, we need the Z53.8, procedure and treatment not carried out for other reasons. So we need to add that Z code on there because what we're doing is we're telling the insurance company this patient came in, they had all of these diagnoses, insurance company. We went to complete these procedures, but we weren't able to finish. But insurance company, we still need to get paid because we still brought the patient in, we started the procedure, but we weren't able to finish it. And so you still will get paid for part of the procedure. So then we have to assign our codes. So remember when we looked here, the patient had an EGD and an attempted colonoscopy. So we have two procedures there. So we have the procedure for the EGD, which is the 43235. And then for the colonoscopy, you're still going to use the colonoscopy code, but then we're going to put modifier 74 on there. So why do we need to add the modifier? We let an insurance company know that we still did the procedure, but modifier 74 will tell the insurance company that we weren't able to finish it. So that's why you're going to put that modifier. And your modifiers are going to be listed in your CPT book in the beginning. So you can go and look at your modifiers in the beginning of the book. But just want to show you how you're going to look at a case study and what are the things that you need to consider. Again, I have some resources that you can look up ICD-10 and it'll actually give you the code. So you can, what I would use it for is look up the code in your book and then use that website, icd10data.com, as a check, just to make sure you have the right information. And so that's one of the case studies. And that's how you're actually going to do, complete your case studies. So again, you're going to read the case study, and then you're going to look at your diagnoses, find your procedure that was done, and then you're going to assign the CPT code for that procedure. And so think of it as you're telling a story. So when you're actually coding, you're actually telling a story. You're telling the insurance company why that patient actually came in. So that's all that I have for this week. We'll go in a little bit further on our next visit. So that's just what we're going to review this week. So I gave you some great resources, some great tools for you to take a look at to get started with, and take a look at those. Try and do a couple of the case studies in your book, and then in some cases the answers are in the back of the book. So that's going to conclude for today. Thank you for joining. If you have questions, please feel free to email me. Thank you and have a great week.